class, Instructor Asbury here. Let's look at the purposes of the ICD-10-CM for your discussion this week. A classification system means that each condition or disease can be coded to only one code as much as possible, and this ensures the validity and the reliability of the data. This classification system is used to track morbidity and mortality. ICD-10-CM, the International Classifications of Diseases in the 10th revision and clinically modified for the United States, is designed for the classification of patient morbidity, which is the sickness, and mortality, which is the death. This information for statistical purposes and for indexing of the healthcare record by diseases, operations, data storage, and retrieval as well. The World Health Organization is responsible for maintaining that. Each world government is then responsible for adapting ICD-10 to suit its own country's needs, and it must ensure that its modification conforms with WHO's conventions for the ICD-10. The United States version of ICD-10 is ICD-10-CM, International Classification of Diseases, 10th edition, clinical modification. In the United States, the National Center for Health Statistics, NCHS, is responsible for the disease classification system of our ICD-10. Through the years, the use of diagnostic coding has grown. Although coding was originally designed to provide access to medical records through the retrieval for medical research, education, and administration, today's codes are used in many different ways. Today's data needs are dramatically different than they were 30 years ago when ICD-9 was introduced. ICD-10 is advancing healthcare in many ways, with benefits accruing across many major categories. For one thing, it facilitates payment of healthcare services. When we had ICD-9 codes, they were not developed for reimbursement purposes, although we did use them that way. That use actually came after their implementation. ICD-10 offers more rational systems upon which to build the payment systems. We have greater specificity regarding clinical conditions and services that are delivered. That's going to help the payers, the policymakers, and the providers with better information in ICD-10. Also, we evaluate patients' use of healthcare facilities or their utilization patterns better with ICD-10, and that's because we have better specificity of diseases, and we can evaluate the use of those facilities, such as patients that have diabetes. We can look at how often they are accessing healthcare. Maybe patients with complications of diabetes, looking at their utilization patterns. We can use it to study healthcare cost, research the quality of healthcare, predict healthcare trends, and also plan for future healthcare needs. The use and results of coding are widespread and evident in our everyday lives. Many people hear the results of coding on a regular basis and they don't even know it. Anytime you listen to the news or watch a report and you hear about the spread of flu that's increased this week, or one state has more cases than another, you hear about the number of AIDS cases, you're hearing the results of diagnostic coding. You can find more information about this in your step-by-step medical coding textbook on page 26. If you have any questions or would like to discuss anything with me, you can get a hold of me between 9 a.m. and 9 p.m. Eastern Standard Time. Thank you.